The Canadian government says it is working hard to bring down patient wait times, but some patients are getting tired of waiting. A growing number of Canadians are choosing to pay for their operations in exotic locations like India. CTV's Avis Favreau followed one man who waited years for help here at home and finally decided to travel overseas for relief.
The pain is etched in Jeff Clark's face.
It's been chronic pain, like everyday pain for about 4 years now. If it wasn't for the narcotics and the pain management I'm on, I wouldn't be able to walk.
He lives with severe back pain, likely caused by work injuries. But no one in the Canadian healthcare system has been willing or able to ease his suffering.
I've seen anywhere from 3 to 4 surgeons over almost a three-year period. Each time I waited a year to see these surgeons, and once I did see them, they had nothing to offer.
One day he saw this.
World-class surgeons can perform surgeries almost immediately.
An ad offering surgery in a matter of weeks at a hospital in India. A company appropriately called Surgical Tourism. Surgery for $15,000 Canadian with 4 weeks of rehab in a 5-star hotel.
If I don't have something happen within the next year or two, I could be in a wheelchair, and there won't be anything I can do about it. So this opportunity, I have to grab it.
So Jeff left the delays and uncertainty of Canadian healthcare for the Apollo Hospital in Chennai, India, where tests quickly showed he had 2 severely damaged discs.
We need to understand the problem well, realize the pain, the source of pain, the reasons for the pain, and then proceed with the treatment paradigm. And to that point, it looks, I think he will do very well with this.
The hospital seems state-of-the-art. Jeff's surgeon was trained in England. So many Canadians are waiting for surgery, hips, knees, even heart surgery. They're starting to look for quicker solutions abroad.
This is something that's happening. It's new to Canada, but this is here for the long run.
The agency coordinating Jeff's operation says business is booming.
When we started about 2 years ago, as you know, we only had the odd case, here and there. Since January 2007, it has gone up to 7-8 patients a month, and it's increasing every month.
Like this Canadian woman who went to India for weight loss surgery.
I opted not to get onto the wait list in Canada. I just researched where I could get it done on my own.
Less than a week after his surgery, Jeff is clearly better.
I feel surprisingly excellent. I was always bent over. Now I'm right straight up and stronger than I was.
It's the kind of happy ending that makes for good advertising. But Canadian doctors urge caution.
There's a risk involved, but first of all, is the surgery the right thing to do? Is it really going to work? You're going to a place where you don't know the doctor. You arrive on a plane and you get off the plane and there's the doctor. You don't know what type of rules and regulations govern their practice.
But 2 months after his surgery, Jeff is certain it was worth taking the chance.
I haven't been on any pain medication now since the first week after surgery, and I've been doped up like a horse for 6 years. I got more than I ever could have dreamt of, really.
Jeff says he's seen the future of Canadian healthcare, and for some, it may not be in Canada anymore. Avis Favreau, CTV News, Toronto.